It's just getting set up. So another maybe 10 seconds or so now.
I think I got a signal that it's streaming live on YouTube.
Yeah. So it is just about to be streaming live on YouTube now. And what has happened is now we both have gone live onto YouTube. So to all the guys who have joined us on this YouTube session, first of all, let me just welcome all of you to our channel. And this is going to be an interactive session with Dr. Parikshit Tank. He is a very well-known gynecologist. He practices in Ghatkopar where I practice, and we've been very good friends over the last few years. So apart from giving a very meticulous and a broad introduction, let me please tell all of you that this is going to be more like a question answer session, which is going to follow. And it is going to be primarily for the benefit of a broader audience. Apart from the medical community, this session is being conducted to benefit a lot of women. Okay. And of course, Dr. Parikshit, I welcome you on this session. And thank you so much for accepting this and joining us. And I'm looking forward to listening from you as you enlighten us on this very, very hot topic, COVID vaccination in pregnancy and in women's health. Now, just one opening statement before I start asking questions. We all know one thing for sure, that vaccination is one thing which is going to reduce the mortality when somebody contracts the COVID, right? It's not going to probably reduce the infectivity of the virus, but it is just going to give us a lot more protection. And simultaneously, it might help us in reducing the transmission. And this is hardcore scientific data which we currently have available. Now, based on this, a lot of companies and a lot of countries have tried to push this, that COVID vaccination should be given in pregnant women as well, because we all know that when COVID affects a pregnant lady, it can have little grievous consequences on that particular lady as well as on the fetus. And I think that is the reason why the organizations are trying to push the COVID vaccination in pregnancy. So let me ask you the first question, okay? And this is going to address to a broad audience of doctors as well as healthcare professionals and patients and routine audience. So when I talk of this, do you think, Dr. Parikshit, that COVID vaccination is safe in pregnancy? आपको लगता है ये safe है?
Thank you, Dr. Mehta. It's really a pleasure to join you today in this space. I've heard a lot and I've seen a lot of the recordings and the programs which you've put forth in your channel, and all have been very interesting and enlightening. So it's a delight to join you today. And you've sort of sent me a Yorker first up, right on the first ball. So
yeah,
I think this is the one question which will be the central issue when it comes to vaccinating pregnant and breastfeeding women. So when we talk about safety, there are 2 or 3 aspects that we need to address as far as specifically about the vaccine in pregnant and breastfeeding women. What we are concerned about is teratogenicity. The second thing is the risk of infecting the baby, and the third is thromboembolic phenomena. So I'll just take each one very quickly. The most important thing that we need to keep in mind is that both the vaccines that are available in India, Covishield and Covaxin, they have no mechanism for replicating, and there is no mechanism for causing a viremia in the person whom you've injected the vaccine. So without there being a viremia, that means there is no viral infection in that host, and after that there is no replication of the material what you have injected. There is no question, means there is no scientific basis of how this virus can get transmitted to the child who is in utero, and there is no mechanism how it can go and affect its organ formation, etc. either. So there is no biological basis for us to believe that these risks exist. Yes, theoretically there is a risk that there could be a thrombus because of the vaccine, clot formation in the legs. But remember that the chance of getting a thrombus because of the COVID disease is about 10 times more than what can happen because of the vaccine. So the risk is very much lower as compared to the benefits what the vaccine can give to the pregnant and breastfeeding woman. So as you
Correct.
correctly mentioned that yes, there are lots of benefits of vaccine for the general population. That is less risk of infection, less risk of severe disease, less ICU care, less hospitalizations. And remember that the only way that we are going to beat this pandemic is mass vaccinations. I mean, unless a
Right.
country reaches 60-65%, we are never going to get through this pandemic. So benefits all around, and specifically to the pregnant woman, let's remember that pregnancy itself can act as a comorbidity. We are all
Yeah.
familiar with what diabetes, lung disease, immunosuppression can do when the host gets infected with COVID. So in the last part of pregnancy, that itself acts as a comorbidity, and the outcomes are worse in pregnant women who are in the last part of pregnancy as compared to their non-pregnant equivalents.
Right.
So that's the benefit. Second, you get two for the price of one. It's now known that antibodies that the mother is generating will
Yeah.
go through from the mother's blood through the umbilical cord into the baby, and
Yeah.
it also goes through the breast milk. So you're getting
Correct.
protection for the fetus and the neonate along with protection for the mother. So huge benefits on that front. And of course, the risks are either theoretical or very, very small in comparison to the benefits.
So let me just address it in very one simple line to everyone who is listening to this. COVID vaccine in pregnancy safe hai, but we are supposed to wait as doctors, as gynecologists, we are all waiting for the Ministry of Health. हम सब wait कर रहे हैं that Ministry of Health comes out with an official statement stating that please go and give this vaccine to women who are pregnant. Okay. So till that time we are going to wait. But if anybody has a fear, that COVID vaccine is going to affect the baby, it's going to cause some hand defects and eye defects and mouth defects and all these things. So these doubts, jayaz nahi hai. These doubts are beyond the realm of science. So let's not unnecessarily, try to terrorize the vaccine by stating that all this can happen, may happen. There is no evidence to prove that, and I believe in very simple words that that thing is dumbfounded. Okay, so with this I go to the next question, Dr. Parikshit. लोग बोलते हैं कि okay, you can give it in pregnancy, okay, and you're going to pass on the benefits to the fetus. But let's assume somebody has delivered, so now she's no longer pregnant, she's a lactating mother, correct? अपने country में, going by the guidelines and all, as all of us as gynecs, we recommend that 6 months of exclusive breastfeeding is very important, correct? So can a lactating lady take the COVID vaccine when she is breastfeeding her child?
So again, ये बिल्कुल बहुत ही इम्पोर्टेंट क्वेश्चन है, और ब्रेस्ट फीडिंग करती हुई महिलाएं जो है उनके लिए ये एक वरदान है, उनके लिए भी और बच्चों के लिए भी, क्योंकि
True.
ये एंटीबॉडीज अगेन ब्रेस्ट मिल्क से जाएगी, बच्चे को सपोर्ट करेगी, उसको प्रोटेक्ट करेगी. So definitely this is something that we will advocate for breastfeeding women also. Again, but as Dr. Mehta has mentioned that we have to wait compulsorily until the Ministry of Health and Family Welfare gives us a final go ahead. Now the good news is that जो national expert group है vaccinations का, उन्होंने मंजूरी दे दी है. They are very much supportive of this step, and now of course it goes through a process. I mean, it's not as if a group of people.
It takes a month.
Yeah. So that's what we are expecting, that next 2 to 4 weeks we should be able to roll out to pregnant and breastfeeding women.
Right. One more thing. Again, this is very commonly asked, and this is circulating on a lot of WhatsApp groups. So I just wanted to have some clarity. somebody mentioned, and it's a proven report, that a pregnant lady died in Brazil after having given the vaccine. All right. But a lot of details regarding that pregnant lady have not been out. So the question is that, let's assume, हमें सबको पता है as treating doctors that majority of the pregnant women, let's assume they have a normal pregnancy, but all of us also treat women, let's say, who are, having pregnancy with diabetes. There are women who are having pregnancy with blood pressure, preeclampsia and recurrent abortions and multiple other complications. Do you think that COVID vaccine is going to be safe to be given to all these pregnant women who are having these complications as well?
Yes, in fact, मेरा तो कहना ये है कि this group is the priority group who should get vaccinated, because
Correct.
if they get coronavirus infection in pregnancy, their disease is going to be much worse. So, of course, there is a degree of individualization that will have to happen. Say, for example, somebody has very severe hypertension and you're planning to deliver her in 2 days, please don't give her the vaccine, obviously.
Correct.
But, in general, this is the group of women who are going to get the maximum benefits. So it is not only safe, it is, this is the priority group, I would say, the one who has comorbidities. So definitely recommended.
Okay. Next, as you know, I mean, I feel pretty unfortunate that, a country like ours is currently having a shortage of vaccines. And this is a well-known fact now, because I think there have been issues with coping up with the sheer numbers that our country is actually going to need. But now let's assume Sputnik has just become available in our country, as we were discussing before the chat started. And we have Covishield and we have Covaxin. So these are the three things which are currently available for people staying in India, right? Now, out of these three, is there anything which you would say that, I would recommend one against the other, or you would say कि भाई जो मिलता है वो ले लो पहले?
जो मिलता है वो जल्दी ले लो. This would be my recommendation, because ये जो Covishield versus Covaxin versus Sputnik debate है, I think it's completely theoretical. At the moment, there is really nothing to separate these vaccines. Covishield, if you go into the literature, there is some data and some recommendations made in some of the European countries where they also have the choice of an mRNA vaccine.
Yes.
So there, what they are saying is that if you got a choice between an mRNA vaccine and Covishield, then take the mRNA vaccine. But if you don't have a choice, just get vaccinated. I think that should be the bottom line and the message what I want to I want people to take from this viewing.
No, I think it's very important. People must realize this, that whatever vaccine you have available with you, if it's Sputnik, if it's Covishield, if it's Covaxin, whatever you have or whatever you've been registered for, let me put it that way. If it's available, I will again reiterate, only for pregnant women for the time being, wait for the health ministry to come out with the guidelines. We are very firmly of the opinion that these guidelines should be coming out on Twitter or any other platform as an official document, which should be out in the next 3 to 4 weeks as a rough timeline, of course. And then whatever is the vaccine that you have, please go and take it. It's going to be safe as long as you are a pregnant lady. All right. The other question is commonly popping up. I tried to do a lot of research with other people as to what do they want to listen on this thing. And there was this very funny WhatsApp, that this is not about a pregnant lady, but this was about women in general, that the vaccine cannot be taken when the lady is menstruating. And I replied to a lot of people stating that, what are you trying to say? I mean, there is no logic to this. But I want you to address this question. I don't know who came up with this WhatsApp. I really don't know. But
I really wonder.
But how does it affect?
Yeah, I really wonder who would have the time and inclination to play this kind of mischief. It is complete rubbish. I would strongly denounce these kind of false vaccine hesitancy creating messages. So this just puts one more barrier for women to access good healthcare. So there
Correct.
is absolutely no truth in this kind of messaging that, 4 days before the menses, 4 days after the menses, and during the menses, the immunity is not good and so on. This is complete nonsense. There's no other polite word
Yeah.
that I can use for it. Please don't believe these things. They have no value. As Dr. Mehta said, whenever you get a chance, your slot comes up, just go ahead and get vaccinated. No problem.
Yeah. The other thing, Dr. Parikshit, I wanted to ask you was, a lot of people, again, I've tried to address this in one of my YouTube videos, which I had shared it with you and on a lot of our groups, is that a lot of people have this fear that once you take the COVID vaccination, it's going to affect your fertility. You are young and you are married, and let's assume you are trying for a child, or you want to try for a child in the next 5 months, 6 months, 1 year, whatever. You took the COVID vaccine, and it is going to affect your fertility. In fact, uh, probably at your center as well as at my center, we've been giving COVID vaccinations, and we've been asking people to take COVID vaccinations, even to guys who are doing the active fertility treatments, like even people who are for IVF, even people for IUI, even people who are on any form of fertility treatment. They are being given the vaccines without any hesitancy. So, would you like to address this concern, or even this is as dumbfounded as the previous concern was?
I think I could just simply say refer to the answer above, but
Refer to the
just
answer
to
above.
just
Yeah.
to give some data, there have been 7 crore births in the world from March 2020, when the pandemic started, to March 2021.
Yeah.
Even with the disease, the coronavirus disease being a global phenomenon, the fertility rate has not gone down. The growth rate of the population has not gone down. It's the same what it was in the previous 4, 5, 6 years.
Correct.
So I think that should put minds to rest as to whether the disease causes infertility. And also, obviously, if the disease can't cause infertility, then the vaccine naturally cannot cause fertility issues or miscarriages. So I think this can be safely left behind.
Safely left behind. Okay. One more question, which a lot of people have tried to WhatsApp me, and I think probably this should be addressed, is that let's assume somebody has delivered today. So today is 15th of May, correct? Now, after she is delivered on 15th of May, when can she go and take the COVID vaccine? How long after delivery can a lady go and take the COVID vaccine?
So if I had the facility, I would inject her right now. But
Correct.
so I mean, at the moment, private practitioners aren't allowed to give the vaccine to anybody. So,
To anybody. Yeah.
I mean, as soon as it is practically feasible for the woman who has delivered to go to a vaccination center, maybe a week, 10 days or so, she can go and get herself vaccinated. There's no problem. There's no waiting period.
Okay. Okay. One more question, because it's regarding women's health. Do you think this is a very important thing which I quoted to a lot of people, elderly women, and a lot of them have taken vaccines, you know. In fact, we believe that elderly women might be having a slightly weaker immunity, and they've still taken the vaccines, and then they've done very well. All right. Does that data help us as gynecologists in giving the confidence to our patients, especially pregnant women, to go ahead and take the vaccine?
Yeah, I mean, see, the good thing is that the vaccine is working universally. I mean, it is helping
Correct.
older people, it is helping people with comorbidities, and it is helping younger people also. So
Right.
I think this is a very positive point that we can put across, that everybody is going to get benefited and everybody should get vaccinated.
I think that's the key. I think that's the bottom line. We, in fact, let me just ask you as a final question. In all the 20 minutes which we tried to speak about, 25 minutes, whatever, about this thing, if you were to give one message to women in general, regarding the vaccine, what is that one message which you want to give? Be it a pregnant lady, be it a lady trying for fertility, be it a lady age 50, whatever it is. What is it that you want to voice out, and you want women to know about this thing?
I think what I would encourage women to do is, of course, get vaccinated, but also promote it amongst their peers. I mean, in their family. So let there be a very positive kind of a news which goes about the vaccine. So let there be a reduction in the vaccine hesitancy, let the uptake become more. I agree, Dr. Mehta, that there is a shortage of vaccines at the moment, but please remember that we've given 18 crore doses. That's not a small number
Correct.
under any circumstances. So,
Yeah. It's
yes, I mean, it's just that,
relative vaccine shortage.
yeah, I mean,
Let's put it that way.
there is a shortage because we are just so many Indians.
Correct.
So, there's always going to be that mismatch between resources and population. But
Correct.
4 weeks, 6 weeks down the line, we all believe that there's going to be a glut of vaccines in the market. There will be more than enough. And at that time, let's not take a step back and say that, no, now I'm getting worried. Let's
Yeah.
put our best foot forward and let's get vaccinated. That's the only way out of the situation that we are in.
Great. So, guys, before I conclude, I will just give a one-line answer, which everyone should try and take home. COVID vaccination is safe for women who are pregnant and for women who are lactating. All right. But as obstetricians, as gynecologists, we all are waiting for an official directive from the government of India or from the Ministry of Health. Once that comes in, all of us are going to start recommending our pregnant women to go ahead and get vaccinated. That is one thing. Second thing, please don't fall for the nonsensical WhatsApp forwards that menstruation is going to affect you and COVID vaccination is going to cause infertility and all these things. Most of these are dumbfounded, non-scientific rumors, which are done just to get something viral, because it's a hot point, and that is why people try to do it. And whatever dosages is available, whatever, be it Covishield, be it Covaxin, be it Sputnik, or whatever you've signed up for, when your number comes, please go ahead and get vaccinated. Even if even if you're pregnant, even if you're not pregnant, as long as you are a lady or a male. But since we are trying to address women's health, as long as you are a lady, please go ahead, try and get vaccinated. The benefit of getting vaccinated from the current scientific data which is available is far better than the risk of not getting vaccinated. And I think that's a very important point. Isn't it, Dr. Parikshit?
Absolutely. I mean, the benefits are so huge.
Yeah.
I mean, and please remember that, your benefits are going to translate into much more than your own individual health. They are going
Yeah.
to translate into the health of your immediate, your immediate family, your surroundings, your locality, and ultimately that's what is going to bring us back to,
Normal.
January 2020 in terms of how
Correct.
we are looking at life. So
Correct.
anyone who's interested in going back to life as it was, please, the only way out is the vaccine.
Great.
Uh,
Thank
I think
you. Yeah.
we might be close to the end, but let me just put
Yeah.
in one more quick point
Please,
that
please, please.
after you've gotten your vaccine, or even when you go for the vaccine, please do maintain all the necessary precautions that you are all taking. Wear
Yeah.
a mask properly, have social distancing, hand hygiene. All this needs to be done, uh, until the pandemic is over. I mean, don't feel that, oh, well, I am vaccinated and out comes the mask. Well, it doesn't work like that. You still need to take precautions. But if we all get vaccinated, then we'll get to the point where we'll throw the mask away.
Correct. Dr. Parikshit, thank you so much for joining me today. And I think probably I don't need to thank you, because considering our relation, I can probably ask you to do one more session in the near future. And thank you so much for these insights. It was wonderful as usual having you. And I hope to catch up one more evening for a nice drink with you. So thank you so much for joining me. And I hope this message is conveyed to everyone loud and clear. So I conclude with this. Thank you so much, Dr. Parikshit, and I'll be